Hi, thanks for visiting us at Baywood Clinic. I'm John, one of the doctors here, and in this little video we're going to show you an example of Botox injecting. And this is one of our most common procedures. We do about 6 to 8 a day, and I believe in North America last year there were over 30 million Botox procedures performed. The reason it's done is to remove lines on the face and to reduce muscle movement. So for example, one of the most common areas, which we're going to do today, is Rob's going to make a squint here, the frown area. A lot of patients don't like this because as you get older, if you squint a lot, you'll end up with the permanent lines, and also a lot of patients don't like that look, especially if they're dealing with people. It's often considered sort of an angry or a look that is unpleasant. So they come and ask for us to remove that frown look. The other two areas that are very common are, if you lift your eyebrows, Rob, you'll see he doesn't have much of it, but patients will often get horizontal lines across the top of the forehead, and the Botox will slow or stop the movement of the muscle and also reduce the lines. The third area is a squint, and we all know what crow's feet are, the little lines that run off the eyes, and so that's the third area. So the three biggest areas we do are the frown, the forehead horizontal lines, and the crow's feet. So it's important to understand about Botox pricing. It's a unit of Botox is kind of like a gallon of gas. It's just a unit of Botox. We charge $10 a unit here at Baywood, and I think in Toronto, certainly for physicians doing it personally, that's the lowest amount. And every patient needs a different amount of Botox in different areas. Everyone's unique. So for example, the frown, here we go, most men will need somewhere between 30 and 40 units. And so what we're going to do, I'll demonstrate this now with Rob. We're going to get our alcohol, and we're just going to make sure the area is properly prepared. And then the next step is to inject. And I like to inject, if you frown, I'll show there's three muscles. This is a corrugator, the big bulky muscle here. We have one on this side, we have one on this side, and the procerus is this sort of little triangular one in the middle. So I like to do one injection in each corrugator and one in the procerus. Some doctors like to do 2 or 3 injections. I find if you put the whole amount in one spot, it does spread out, and I've been doing that for years, and it's worked very, very well. So you can see what we do now. You make your squint for me, and our first injection, I grab that muscle right there, a very slow injection right into that corrugator, and we do the second one on the other side, right like that, and our last injection will be right into the heart of the middle muscle. We call it the procerus. And there you go. That looks really, really good. You can relax, Rob. And I'm just going to press that there for a second. And I'm going to pass you your ice. There you go. You can hold that there. And if he holds that there for a minute or two, the swelling comes down and he'll walk out of here. No one's going to know this was done. And in 4 or 5 days, that muscle should be completely frozen. And we'll see him again in 3 or 4 months when it wears off. So thank you again for visiting the Baywood Clinic. If you're interested in Botox or any of our other procedures, just check our website, baywoodclinic.com. We offer all aspects of laser and cosmetic medicine and surgery, and we'd love to hear from you and love to meet you. Thank you very much.